Okay, this video is about how to improve outcomes with congestive heart failure. CHF is super common. I'll show you here a typical chest x-ray of CHF. The heart is big, so that's cardiomegaly. There's increased prominence of the vessels upward. It's called cephalization of the vessels. You get pleural effusion, some of the fluid accumulating in the right horizontal fissure. Typically, there'll be pleural effusions. You'll often see sort of patchy opacities in the lung like ground glass infiltrates. And so it's big heart and wet lungs. These are called curly B lines, named after an Irish doctor, and they're just little horizontal lines perpendicular to the lateral chest wall due to filling of the lymphatics in the lungs with fluid. The cardiac shadow is more than half the ratio of the chest. That's cardiomegaly for cardiac enlargement. So that's your typical chest x-ray of congestive heart failure. If the heart was small and the lungs are wet, you think acute myocardial infarction with sudden onset heart failure. Okay, no pleural effusion, small heart. You could have ARDS. Okay, adult respiratory distress syndrome. All right, but CHF is what we're going to talk about today. And here's a typical thing like my doctor buddies will tell me, internist tells me, every single one of my inpatients has congestive heart failure, CHF. It's super common. Also, a typical experience of a radiology resident is, studying for residency, they'll learn like 50 or more lung diseases, all right? And then in clinical practice, all they see all day long is congestive heart failure, pneumonia, and lung cancer, okay? Those are the big three. The Windkessel effect is the ascending thoracic aorta. The heart, left ventricle pumps blood in the ascending thoracic aorta. It stretches outward by the force of that contraction. It has a lot of elastic fiber, so during cardiac relaxation, they recoil inward, and that propels blood during diastole. Systole means contraction, so that's like the Greek word for when the heart contracts to pump blood. Diastole is when the heart relaxes, and that's the time when the elastic recoil of the ascending thoracic aorta comes inward to push blood during diastole. So if you look at a blood pressure, the top number is systole, cardiac contraction. The bottom number is diastole, cardiac relaxation. So a lot of this blood flow is generated by the elastic recoil of the ascending thoracic aorta. And it's named after that thing that looks like a little accordion that you blow air onto the embers of a fire. It's called a Windkessel. So normal, healthy ascending thoracic aorta has a lot of elastic fibers, and it generates a Windkessel effect whereby the elastic recoil inward during diastole to propel blood. That ends up being really important. When that's working well, the pulse pressure is usually small, which means the difference between the top and the bottom number. So the person's healthy. When a person eats high-fat food, making their blood thick, because it sticks the red blood cells together chronically, decade after decade, they keep overstretching this ascending thoracic aorta, and once those fibers are gone, you can't replace them after you're in your 20s. So the Windkessel effect fades away, and they end up with more of a systolic hypertension. So let's say a person is quite hypertensive with a pressure of 200 over 100. That's a wide pulse pressure, meaning the big number on top is a lot more than the lower number. Pulse pressure is the difference. So this would be a pulse pressure of 100. This is a pulse pressure of 40. The difference between the top and the bottom number. Anyways, the real high pressures, they bang against the walls at bifurcations, the little median divider between a bifurcation, and they damage the arteries. The arteries compensate by producing more collagen, fibrotic tissue, which decreases the function of the artery and leads to decrease. It's going to lead to atherosclerosis and decrease oxygen delivery to the tissues. Okay, so loss of Windkessel effect is a big deal, and it's super common in Western countries. Okay, the left heart's going to have to pump blood at a higher pressure, so the muscle wall is going to thicken. That's called LVH, left ventricular hypertrophy, and that means that a thicker muscle is going to need more oxygen delivered to itself. But you see how this is becoming a vicious cycle? If you're going to have less diastolic flow, less Windkessel effect, and the cardiac muscles mainly perfused during diastole, that means the cardiac muscles having a harder time getting oxygen and glucose delivered. Does that make sense? Because you have to pump at a higher pressure, so you get a thicker muscle, meaning the thicker muscle is going to need more oxygen and glucose, but there's less diastolic flow because you've lost the Windkessel, so you're going to have a hard time. You'll have increased demand of the cardiac muscle because it's bigger and thicker and it's pumping harder, but decreased ability to deliver that glucose and oxygen, so you can get a vicious cycle going, and the patient spirals down into the dumpster, sick, suffering, dead. Good mitochondrial function will improve cardiac contractility. You want that. You don't want high-fat meals because it makes the blood thicker instead of the blood being normal like water. And the reason you have blood pressure is to get blood to the top of your brain to pump against gravity. So you don't want thick blood, like high-fat meal sticking your red cells together, making the blood thick. Then you got to pump at a higher pressure to get it up to the brain. That means more work for the heart when you pump at a higher pressure. You don't want sodium because it's a vasoconstrictor, inhibits endothelial nitric oxide, clamps the vessels down. You have to pump at a higher pressure to get blood through tight arteries. And if you're pumping a higher pressure, you're increasing the workload of that heart, a heart that's already struggling to get enough oxygen and glucose delivered to it, to get enough blood flow. So you're shooting yourself in the foot, okay? You don't want to be excessive psychological stress, sleep deprivation, caffeine. They're all perceived the same way by the body. It increases the catecholamines and the cortisol, but the catecholamine hormones are going to speed up the heart rate and increase contractility, meaning more work for the heart. So what you want is to avoid unnecessary stress on that heart with congestive heart failure. Okay, I'm just showing you a case report by this guy right here. He's a cardiologist out in New York. And he wrote a case report about a patient who, 79-year-old guy with dyspnea on exertion, DOE, shortness of breath, 3-vessel coronary artery disease, ejection fraction 35%. So bottom line is heart's not working well, and all of his coronaries with severe blockages, 80 to 95%. Okay, he goes vegan. Within 6 weeks, his ejection fraction is up to 50%. That's a big increase to go from 35% to 50%. Okay, and his exercise tolerance went from being short of breath with small exertion to being able to walk a couple of miles without being short of breath. Okay, within 2 months of going whole food, plant-based diet, his total cholesterol came down from 201 to 137. That's a dramatic drop. Okay. His HDL also went down, which is going to happen. It's like if you have a watermelon, you cut the watermelon in half, everything is going to be reduced. Okay. So that's rather remarkable. So what I'm trying to say, it is in the literature of congestive heart failure being reversed by optimizing diet. Okay. Okay, here's a lady. This lecture is actually over at the Chef AJ channel. There's a lot of good lectures over at the Chef AJ channel, so I'm not going to be petty. I want you guys to have the best information wherever it comes from. Okay, so this nurse, she works with congestive heart failure patients all the time, and she says that whenever they used to put the patients on the old-time American Diabetic Association diet, not a single one ever reversed their diabetes. But she says you put them on a whole food, low-fat, vegan diet, and it's pretty easy to reverse type 2 diabetes with that. Dr. McDougall says every single patient, 100% of them, if they go low-fat vegan, they'll reverse type 2 diabetes. And if they don't, they probably got type 1.5. Okay, and here's something I want to show, and this is sort of my big contribution to all of this, is that I was interested in mitochondrial function. And I knew it was a big deal because I knew fat inhibits complex 3, and that contributes to insulin resistance with diabetes, okay? Especially fat. And I knew there had to be a bunch more mitochondria inhibitors. I'd heard of some antibiotics doing it, but I decided to go back to all my biochem books, and I own about 7 of them, and there was nothing about mitochondrial inhibition in there. So I went through a bunch of research papers. I quickly found over 50 mitochondrial inhibitors, and many of them are very common. And you want good mitochondrial function because that's where most of your energy is produced in your body. And so look how common these things are. Tylenol is a mitochondrial inhibitor. Atrazine sprayed on GMO corn is a mitochondrial inhibitor. Glyphosate sprayed on GMO soy is a mitochondrial inhibitor. Statin medication is very common, mitochondrial inhibitor. Metformin, very common for diabetes. Lasix, a water pill sometimes used to treat hypertension. Serotonin selective reuptake inhibitors used to treat depression, mitochondria inhibitors. Processed food, they want it to have a long shelf life. Same thing with fast food. So they put a lot of mold inhibitors in there, typically antifungals. Many of those are mitochondria inhibitors. Processed food often has food dyes in it. Many of those are mitochondria inhibitors. Some common antibiotics like fluoroquinolones, aminoglycosides, beta-lactams, they're all mitochondrial inhibitors. And it goes on and on. BPA plastic, it has a mitochondrial inhibition effect. PFOA from those non-stick cookware. So it's all bad. F- in tap water, HNE from omega-6 cooking oils, they're all mitochondrial inhibitors. So what I'm saying is people are being nickeled and dimed, death by 1,000 cuts, trashing their mitochondria, which means their energy production. And that's partly why these people are so tired and sick and weak and cognitively slow. Okay, so here's a little bit about normal heart versus congestive heart failure. So the left ventricle is going to pump blood, it's sort of behind this right here, into the ascending thoracic aorta. when you're having to pump at higher pressures, this wall is going to be hypertrophy. Compare this left ventricular wall with this one. So that's LVH, left ventricular hypertrophy. Okay, and if the left ventricle can't pump the blood at an adequate rate, then you're going to get backup of blood into the main pulmonary artery. So here's the left pulmonary artery, main pulmonary artery, which means the lungs are going to start filling up with fluid. You'll get pulmonary edema. Okay, but this is sort of a typical thing in the heart. As it fails, it'll start to dilate. Okay, here's some basic stuff about why high-fat meals cause blood sludge and make the blood thick like a milkshake. The red blood cells get stuck together by the high-fat meals. They're called bridging molecules. So LDL cholesterol is a bridging molecule. It sticks the red blood cells together. Other things that stick red blood cells together include fibrinogen, the clotting protein. Chylomicrons will do it. LDL cholesterol does it. Uric acid from eating too much high fructose corn syrup and some meats. I'm going to talk a little bit later about clotting due to leaky gut, postprandial endotoxemia with LPS and LTA. IgM antibodies, that's the first antibody to go up during an acute infection. So those will also, and they're big enough and they're positively charged, they can be a bridging molecule here and stick the red blood cells together. Normally the zeta potential, the negative charge on the outer surface of red blood cells, repels them from each other, so they don't stick together. The negative charge comes from cholesterol sulfates, heparin sulfates, and sialic acids on the endothelial glycocalyx, the outer surface of the red blood cell. The higher the LDL cholesterol, the higher the blood viscosity, meaning the thicker the blood. There's a good video at Dr. McDougall's YouTube channel. It's called Dr. McDougall Medical Center's his channel. The video is called Blood Sludge from a High-Fat Meal. It's only 50 seconds long, and what it shows is normal red blood cells traveling around pretty well independently, minding their own business. But after a high-fat meal, you get the chylomicrons sticking them all together, and that decreases oxygen delivery to the tissues about 15 to 20%. Roy Swank did a lot of that work, and then Dr. McDougall worked with Roy Swank on that work as well. Okay, let's see here. This is just showing you that if a person has baseline coronary artery disease and narrowing of these arteries, they'll also typically have less ability to dilate in response to increased demand. So these patients can get themselves in trouble pretty fast. And here's one article about this. A single high-fat meal adversely affects postprandial endothelial function. So all it takes is one meal and you're already having a damaging effect on your arteries. Oh, and this is how to cause a heart attack. So you got baseline atherosclerosis in the patient. They eat high-fat meals. They get the poor blood flow like we talked about. They get insulin resistance from diabetes. They get hypertension from that as well. You put sodium in there and vasoconstrict them. Cold weather, so they vasoconstrict from the cold weather, being cold. Stress them out, increasing cardiac muscle demand and making the heart work harder. Tobacco is another stimulant. Leads over time to higher hematocrit in a bad way. Lack of plant foods, they got all the vasodilators in there, and then you can increase metabolic demand. Oops, I'm sorry, I don't want to move that. Through stimulants and stress. Okay. Now we talked about this before. Caldwell-Esselstyn, has the best work on this. That you can partially reverse atherosclerosis. You can reabsorb the necrotic core, the lipid core, the acute clot component, part of the hypercellular, the cellular fibrotic tissue, not the acellular fibrotic tissue. There's some people saying with time, years, you can reverse calcification. I've never seen it, so maybe you can real slow, but in the acute setting, that's not too relevant. But the important thing is once you cut the fat in the diet and you cut the sodium, the endothelial cells will function better, produce more nitric oxide, you can get more vasodilation, so you can get a big improvement in just days, pretty quick. This is the paper of Peter Quo, cardiologist from Pennsylvania in the 1950s, fed the patient sat fat, caused chylomicron blood sludge, rouleau formation, and basically 4 to 6 hours, these are cardiac angina patients with coronary artery disease-related chest pain, their symptoms will go up. At peak, he knew the lipids were at because he checked their blood lipids every 30 minutes. At peak lipemia in the blood, they would have peak amounts of anginal episodes, okay? And then work was repeated in the 1960s with omega-6 cooking oils. And these stuck the red blood cells together even worse. And Meyer Friedman and Ray Rosenman did some of these experiments in the 1960s. They also looked at the eye with an 80-fold magnification microscope, and they could see small blood vessels becoming occluded after the high-fat meal. So what does that mean? It means you don't want to be eating high-fat, high-sodium meal, all things considered. You have to work with your individual doctor and work out the details of your own blood levels of sodium and potassium. The patients can be very complex on diuretics and stuff, so that requires management by a doctor. Oh, by the way, I like this guy Medcram. Roger Seaholt, the Medcram is the name of his YouTube channel. And he'll have videos on all the medications if you're interested in that for congestive heart failure. Okay, I think he's pretty smart, and he did a lot of training too. He's a boarded in critical care. I think he's boarded in sleep too. So he's like 4 board certifications. Okay, Mayo Clinic did a study on over 2,000 hysterectomy patients, and they found women who had a hysterectomy before the age of 35, they had 4.6 times increased congestive heart failure, because when a woman menstruates, it's a therapeutic phlebotomy. Every month, she lowers her hematocrit, meaning the percentage of red blood cells in the blood. And by lowering the hematocrit, she makes her blood less thick, so she's less likely to get hypertension. In addition, the red blood cells, when they first come out of the bone marrow, they're more flexible, more deformable. A red blood cell has to deform to pass through a capillary, because typical RBC is about 7 microns in diameter, typical capillary is about 5 microns. So, as a red blood cell gets older, it gets more glycated, like hemoglobin A1C, as it moves towards its typical 120 days of life. In addition, you get something called phosphatidylserine externalization, meaning that the phosphatidylserine moves from the inner leaflet to the outer leaflet of the plasma membrane. So that makes the red blood cell stiffer too, less deformable, less able to pass through capillaries. So women, they're usually kind of oblivious to things like hypertension. They don't have to worry about impotence. They almost never get a myocardial infarction before they're 50, so they don't see it coming. Typical guy, by the time he's in his 30s, has already heard of some guys having heart attacks, heard of some guys going impotent. He's like, uh-oh, I better get my act together, okay? Versus the woman, she gets hit by surprise, blindsided by all this hypertension. Whenever I get a demented brain and there's no obvious cause, I look for the usual suspects. Is she an alcoholic? Is she a drug addict? Something like that. And if the answer is no, then I look in her surgical record and see if she had a hysterectomy, and that's what it usually is. Okay, so here's a little bit about the arteries. Coronary microvascular dysfunction, sometimes called syndrome X, and what this means is when everybody talks about the coronaries, they're always talking about the big ones. The big ones are on the outer surface of the heart. They're called the epicardial coronaries, but there's ones that penetrate into the branches. They have branches that penetrate into the muscle. So the big ones are like left main coronary, left circumflex, left anterior descending, and the right coronary. Okay, those are the big epicardial branches. Those are the ones that you can do an angioplasty and a stent in. Those are the ones you can do a surgical bypass, CABG, coronary artery bypass graft. However, you got tons of these little branches that penetrate into the muscle. And what I'm trying to say is you're going to perfuse these little guys when the left ventricle is at relaxation during diastole. And if the left ventricle is hypertrophied, LVH, left ventricular hypertrophy, and if it's chronically contracted, pumping at higher pressures at faster rates, you're going to have a harder time getting blood into that muscle, okay? And then if you got little blood clots floating around in your blood because you got postprandial endotoxemia, that makes you prothrombotic, and you're stressed out, and you're drinking caffeine, and you're sleep deprived, all those things make the blood thicker, more prothrombotic. You're going to be more prone to plugging up these little arteries and develop microvascular angina, which will then make the cardiac muscle relatively ischemic, less able to do its job, less able to pump blood. So what I'm basically saying here is the way you're going to improve congestive heart failure outcomes is to add this diet knowledge to the treatment, as well as avoidance of the mitochondrial inhibitors. Okay, so normally you eat fiber, the good bacteria, make it into butyrate, short-chain fatty acids. Those are used to make tight junctions. You don't eat the fiber, you don't get the tight junctions. Plus, all these things can also injure the gut wall. Everybody knows this stuff like NSAIDs, non-steroidal anti-inflammatory drugs, and a whole bunch of other things. Okay, so if you got leaky gut, you get the bacterial endotoxin, LPS from the gram-negative bacteria, LTA, it's called, from the gram-positive bacteria. That gets through the endothelial lining when the tight junctions are dehiscent, and they can get into the blood, and it makes the blood more prone to clotting. It actually specifically causes a type of clot called dense matted deposits. It's an amyloid transition, meaning the secondary protein structure. Secondary protein structure of the fibrinogen changes. It changes. Oops, I can't change my picture there. There we go. And what that means is it goes from being like a slinky, alpha helix, that's called secondary protein structure, to being flat, that's called beta pleated sheet, and they start to connect to each other, bind to each other with intermolecular hydrogen bonds, and then they precipitate out of solution. The bigger a molecule is, the more likely it is to precipitate out of solution. So here they're individual. Here they're all stuck together into a big aggregate, and they call these dense matted deposits. These two right here Etheresia praetoris from South Africa, Doug Kell from England. They're two brilliant PhDs. They deserve Nobel Prizes. They figured out a lot of this stuff. Most of this work is all from them. They'll never get it, though. Nobody wants the pros to know the truth about the significance of these high-fat diets. Excessive free iron in the blood can also do this. Most people are iron overloaded in Western societies. Men after like about age 25, women after they're postmenopausal. Okay, so this is just more of the same. This is showing normal clots. The fibrin clotting protein looks like a piece of spaghetti, and the body can dissolve that pretty quick when it wants to. Dense matted deposits with these abnormal LPS, LTA, or excess iron overload clots, they're all amyloidogenic transformations of the protein, fibrin, blood clotting protein secondary structure, and they're very difficult to lyse. So what they're trying to say is if you plug up an artery with this stuff, it's harder to reopen that artery. Viral proteins can also cause this type of clotting. Okay, and they've got lots of lectures. If you watch Doug Kell and Etheresia praetoris, you'll see all their lectures on these subjects. It can also distort the shape of the red blood cells, which can decrease ability to deliver oxygen. And this also ties into my other theory here. This is my theory of dementia. And that's one of the reasons why I'm presenting this talk. What I'm trying to show you is that my mitochondria are more important than people realize, as well as this concept of supply and demand in terms of what does the cell need. The cardiac muscle needs glucose and oxygen, so it can generate ATP, it can generate energy. It can produce ATP from the glucose and the oxygen running its mitochondria. And if you inhibit the mitochondria, it can't produce as much energy. You're not going to be able to pump the heart as effectively. And you also run the risk of this apoptosis problem where you've got a metabolic rate of a cardiac muscle. Just I previously talked about this with brain cells. And you got oxygen and glucose delivery. Well, if you increase the metabolic rate of the cardiac muscle cell due to stimulants like caffeine and the similar effect of excessive psychological stress, sleep deprivation, or tobacco, all those things can increase the rate. Amphetamines for attention deficit, whatever. Then you got to increase the oxygen glucose delivery in order for that to have that cardiac cell function well. And if you simultaneously throw on top of it mitochondria inhibitors, SERCA inhibitors, you're going to have a much harder time getting that cell to function well. And there's also, I forgot to add the slide in of all roads lead to calcium, meaning that when you get elevated cytoplasm calcium concentration, the muscle will contract. And there's other things that contribute to that. Like a lot of people, I know a cardiologist, and he's actually a real smart guy. He was an AOA, meaning top 10% of his medical school class. And he puts his cell phone in his front pocket, which I told him was incredibly stupid, and he kind of laughed at me. But he's putting his cell phone in his front pocket. It's a low power microwave transmitter. You're putting a low power microwave transmitter right over your heart. Okay, it opens up voltage gated calcium channels. Not an intelligent thing to do. Okay, and here's just a bunch of these mitochondrial inhibitors. I showed you the picture before, but here just seeing it again. So there's tons of them. So like if I had a problem where this was relevant, and I just avoid all these things anyways. But I mean, what I would do if I had a CHF patient that really wanted to optimize their chance at a good outcome, I would try to avoid all this stuff to the extent that it's possible. Of course, you got to look at the risk-benefit ratio for stopping a pill. There might be some benefit for that pill where you think the benefit outweighs the side effect, but I wouldn't take anything. I certainly didn't need to. This guy's a genius over here, Martin Pall, and he came up with the no theory, the nitric oxide peroxynitrate theory, and he believes it's a major, major contributor to the problems with congestive heart failure. And so he's written all about that, and he's got a lot of online lectures. He's really smart. He is a genius. He's a little bit awkward to listen to because he's kind of like an Asperger autistic, but he's super smart. So here's his one of his papers, The No Cycle as the Central Cause of Heart Failure. So it's right here, 2013, Martin Pall. Okay, next thing is I just summarized some of the things. So anything that thickens the blood is going to be bad, which is basically all your fat, things that elevate uric acid, potentially, taking big calcium supplements because it's a clotting protein and you bolus your blood with that. I wouldn't do that. Things that stiffen RBCs, advanced glycation end products, I would avoid all those things, which usually means animal foods and high-fat foods. That's another reason why I avoid things like nuts that have high advanced glycation end products. Anything that causes insulin resistance working against you. And you want to be active. Walking a lot is what we're sort of humans are designed to do. Alcohol ends up being damaging, leads to fatty liver and other problems. Increases the risk of diabetes. You get the good stuff in the plant foods. You get the magnesium, the potassium, the fiber, the antioxidants. And like I said, all the things that lower pump power are bad. Mitochondria inhibitors, SERCA inhibitors. things that sort of make you happy, lower your stress level, comedy, laughter. Okay, so that's all I got. I hope that was helpful to you. And the cardiology doctor that a person goes to, they're going to know the medications very well, but they usually don't know anything about nutrition, and they usually don't know anything about mitochondrial inhibitors. They usually don't know the fact that CHF has been reversed in some cases with diet. So anyways, that can improve outcomes with CHF. Hope that was helpful.